All right. Good morning, everyone. My name is Allie Wells. I'm the Communications Director at the Foundation for a Healthy Kentucky. Happy Friday. Thank you for joining Health for a Change, improving health literacy in your community. I want to start off by thanking our speakers who have dedicated their time and energy into this webinar today. We've got joining us Emily Beauregard, the Executive Director of Kentucky Voices for Health, Elizabeth Edgehill, the Director of Refugee and Immigrant Services for Family Health Centers, and Kelly Warren, the Executive Director of Appalachian Kentucky Healthcare Access Network. I will turn things over to them in just a moment. I just have a few quick housekeeping notes to go over with everyone as you're hopping on. If you have any questions during the webinar, you can put them in the chat box or I'm not saying the Q&A, so you can put them in the chat box. Um, there are no pre-approved CE credits attached to this webinar. However, I can provide people with a certificate of attendance for being on the full webinar today. Keyword there is full webinar. I will be able to tell if you leave after 10 minutes, so you've got to stay on the whole time to get that certificate. My email is up on your screen right now. If you want that, you just need to send me an email this afternoon or in the next few business days. The subject line should say request for certificate of attendance, and your body of the email just needs to say your name and the title of today's webinar. I'll also include these instructions in an email once the webinar is over. That email will probably go out on Monday, and it will also include a recording of the webinar today. So it will be recorded and you will get those links. Just to tell you just a little bit about the Foundation for a Healthy Kentucky, we are a nonprofit organization funded by an endowment that aims to transform our state so that every Kentuckian has what they need to live a healthy life. Our mission is addressing the unmet health needs of Kentuckians, and our two focus areas are access to care and children's health. We do our work through policy advocacy, we build partnerships and bring together constituency groups, we fund research and data, and we fund and support community interventions and projects that improve the health of Kentuckians. I'm going to stop sharing my screen now. So at FHKY, we know that access to quality healthcare and health literacy go hand in hand. People who struggle with health literacy are more likely to have worse health outcomes, and our speakers are going to touch more on that. But there are ways that people who are active in their community can help their fellow Kentuckians, and that's why we're all here today to hear about this resource. So with that, let's get things started. And Liz, I'm going to turn things over to you now.
All right, good morning, everyone. I'm Liz Edgel, and I'm a nurse at Family Health Centers in Louisville. And as a nurse, I realized how important health literacy was in trying to improve patient outcomes and trying to increase understanding. So I think that you'll hear from me and my colleagues, Emily and Kelly, that we all have a passion for health literacy. So we want to share some opportunities for you guys to further the cause. Next slide. So our plan today is we just have 60 minutes. So we're going to do I'm going to do a quick background of sort of the problem of health literacy, why we're trying to address it. And then we're going to share the history and background of a presentation that we created long ago with Health Literacy Kentucky called Lead Your Health Team, Health Literacy for the Win. And then talk about some tools and resources so that you might be able to implement this lesson in your own community and in your relevant networks. So we'll start with the definition and scope of the definition of health literacy, the scope of the problem, and then some strategies. So there's many definitions of health literacy, and it changes pretty frequently, but this is one that we like that's in Healthy People 2030. So if we look more closely at this definition, we're talking about personal health literacy, and that's the degree to which we can find and understand information. So that's about getting useful and accurate health information. Then we've got to understand it, which means knowing how to use the information once we have it. And that using part means in our daily decisions about the health choices that we make, in using any tools or resources we need to keep ourselves healthy, and in acting on those decisions. And then there's the organizational health literacy component too, which talks about equitably enabling individuals. So regardless of education level, insurance coverage, language spoken, health status, or country of origin, everyone who comes to us in our organizations needs to be able to find, understand, and use health information. So we have an obligation as an organization as well to improve health literacy. Next slide. So we could spend all day talking about all of the things we need health literacy to do. So health literacy is required to fill out patient information and consent forms. Sometimes people will conflate it with literacy, like the ability to read and write, and that does have to do with this, but there's also numerical literacy and just health information and jargon. So it's a little more complex than just the ability to read. We need to be able to follow treatment plans. We need to understand handouts or brochures about health topics. There might be cancer screening guidelines and charts, like if you're at this age and you're a woman, you're at risk of this, and you should get a mammogram, or whatever the screening guidelines might say. Medical tools. We know how hard it is for our patients with diabetes to use glucometers, for example, and how every manufacturer makes them different. And every time the formulary changes, they might have to get a new one. So there's all these complexities. One of the things I like to say about what health literacy means is that it also means all of the things that patients have to do between doctor's visits or between hospital stays, right? So we all have that daily health literacy and things that we need to do to keep ourselves healthy. So this is a lot. We are asking a whole lot of folks in our healthcare system. Next slide. So this is an older survey that was done. I guess the National Assessment of Adult Literacy is done by the Department of Education typically annually. But in 2003, they included some specific health literacy questions. And what they found is only 12% of US adults are actually proficient in understanding health information. Other categories are below basic, basic, or intermediate. So it's even highly educated folks, even people in healthcare professions, when they're not feeling well, can have low health literacy. So this is a significant problem if only 12% of adults actually are proficient in this area. The next slide. So what this means in our health system is if that many people are going around with low health literacy, then they may have poor health knowledge. They may not understand their health conditions. They may have poor health status because they may not be getting preventive care or taking their medications correctly. That might mean higher mortality, increased hospital use, definitely increased emergency department use. Sometimes we're kind of health literacy dorks, and we've even talked about different focus areas of health literacy, but that systems navigation, that's a whole area. And if people don't understand or have access to primary care, they're going to depend on the emergency room or emergency department. We know that's the most expensive place and probably one of the riskiest places to actually get care. And yet that's where people will default to, especially if they have low health literacy. And then there's also research shows mixed results for the use of preventive services, chronic healthcare, and tobacco use. So this is why we see it as a really important area for all of us to try to address in our communities. Next slide. So we don't want to just end with the problem. We want to start thinking about how we can try to improve health literacy. At Health Literacy Kentucky, we have always talked about sort of a two-pronged approach. It's not fair to make all of the patients and consumers responsible for improving health literacy. The healthcare system and providers also have a big role to play. So the healthcare system could be simplified. But that's probably a webinar for a different day about the ways that we could do that. And we can also help patients learn how to be more active and confident. So that's the second prompt. And so that's where we'll focus today, is that patient side. So what is Health Literacy Kentucky? I've already mentioned it a few times today, but it's a statewide coalition of folks who are working together to improve health literacy. So fortunately, Emily and Kelly and I all work for healthcare organizations or advocacy groups or training groups that lend our time very well to promoting health literacy. So we're part of Health Literacy Kentucky. But it's all a volunteer-led initiative, and the Kentucky Voices for Health has been kind enough to be our support agency, and we have our website through them. So next slide. when we're going to spend a lot of time today talking about this Health Literacy for the Win presentation. So I wanted to give you a little history about it. It was originally called Play to Win, you and your healthcare team. Um, Knowing that here in Kentucky, we most Kentuckians feel very passionately about our sports, about our UGA or U of L, and we spend a lot of emphasis on that. So we were using that kind of healthcare team metaphor. We had a grant from the National Library of Medicine. I tried to find dates. I think it was about 2011 when we were finalizing this project. And we did a train the trainer model. Basically, we had 4 regional centers. We partnered with AHEX in some regions and FQHC's federally qualified health centers and others. And we trained community members, church leaders, and all kinds of interested parties to be trainers, to be able to literally borrow a laptop, borrow a little projector, and go and do presentations for their communities. That's how it started. And then we didn't do that much with it with the beginning of the Affordable Care Act because we ended up shifting to kind of health insurance literacy and trying to teach people to understand what it meant now that they might have an insurance card, or if they, now that Kentucky had expanded Medicaid and they might have more access to care. But it was about 2022, our partners at UAK Extension realized, hey, this is a pretty good presentation. We could kind of modernize it, tweak it a little bit. And they did so. So that's when it got the name Lead Your Team, Health Literacy for the Win. And then our most recent iteration, we're very proud and excited about, is that we piloted a Spanish version earlier this year in September. So we'll talk a little bit about that as well. And now we didn't want to just talk about this webinar. We want to give you a small sampling. We will not do the full presentation because it's really intended to be about 60 minutes with a community group. The full presentation also has some role plays and some other scripts that go with it, some worksheets. When Extension made it, they literally would drop some educational materials at rural Kentuckians' mailboxes. So they wanted something that they could print out, have some paperwork to go with. There's some videos available. So all of this is available, but our friend Kelly is going to give you a little excerpt of what it's like, the actual presentation. So she's going to pretend you're participants in your community. Picture yourself at a health department or in a church gymnasium or something. Thank you, Kelly.
Thank you, Liz, and hi, everyone. I'm Kelly Warren with the Appalachian Kentucky Healthcare Access Network, where we train community health workers, and I saw some familiar names as you all were coming into this room. But like Liz said, I'm going to present this partial Health Literacy for the Win presentation as if you all were the community audience. So, we'd like to thank you for coming today to our presentation, Lead Your Team, Health Literacy for the Win, as this presentation was originally developed by Health Literacy Kentucky, which is a statewide coalition whose purpose is to improve the health of Kentuckians through improved communication between providers and patients. And so when you look at this slide, there's some X's and O's. I'm wondering if anybody might know what that stands for. Well, they represent a play that may be drawn up for teams to know how and what to do during a game. So if we think about our healthcare as being part of a team, that's the way we're looking at this today. Next slide, please. So by the time you leave here today, we hope that you'll learn a little bit about what health literacy is, some tips and skills about talking with your healthcare team and working with that team, some ideas about taking medicine safely, and 5 things that you can do to become a better member of your healthcare team. So what is health literacy? It's basically our ability to read, understand, and act on health information. And we have to act on that health information in so many ways every day, at the pharmacy, at the provider, what we're supposed to do after and in between visits, sometimes our treatment plan. So health literacy is important all of the time as it relates to our healthcare. So let's introduce who's actually on your healthcare team. I'll read. It starts with maybe you have a nurse practitioner, a nurse, dentist, dietitian, a physician's assistant, a pharmacist, therapist, maybe a mental health therapist or an occupational therapist, or all those other kinds, a social worker, a doctor, community health worker is a major important person on the team. And then the most important person on the team is you. Next slide, please. So, what can you do as it relates to being a member part of a better member of the team? What can we do if we don't understand something that we hear at the doctor's office? Somebody said ask questions. Yes, exactly. It's okay to ask questions in the doctor's office or your provider's office. And it's okay to say that you don't understand things. An example might be if a physician mentions angina, I could say, I'm sorry, could you explain what angina means? That's a new word for me. I've not heard that before. Or perhaps the doctor says, um, you need to have clean eating. You could say, I'm sorry, can you explain a little bit more about what clean eating means? So that those questions are so very important. And it's your job to make sure that if there's anything that you don't understand, to ask those questions before you leave. Here's a good tool to help you with asking those questions. This Ask Me 3 is a tool that you can practice to prepare yourself for going into the doctor's office and then what you need to know when you leave. So, the three primary questions are: what is my main problem? What do I need to do about it? And why is it important? And so let's think about an example. I go to the doctor this week. I've had a cough, a sore throat, a runny nose, and I go to the doctor and I need to know, what is my main problem? Is it a virus? Is it contagious? Is it strep throat? Is it allergies? So once I know what my main problem is, what do I need to do about it? Do I need a prescription? Do I need over the counter medicine, which is medicine that's not prescribed by a doctor, but that you can buy in the pharmacy? Or do I need to get rest? And then why is it important? And this is critically important because why do I need to take my prescription as prescribed? Because if I don't finish it, my strep throat may become worse and cause a larger infection or a higher fever. And so those are the three questions. What is my main problem? What do I need to do? And why is it important? So when you're in a provider's office, here's some tips. Tell your story. The doctors and the nurses and the people who check you in, they're not mind readers. They're not going to know how you're feeling. Providers might be experts about health, but you are the experts about how you feel and what you're experiencing. So be sure to tell them everything. And all the details matter. Are you taking any supplements, any herbals, any over-the-counter medications? Are you doing anything that maybe mama or grandma had you to do that was a home remedy? All of those things are really important. And when it comes to those kinds of home treatments we might do, it really makes a difference. An example is somebody told us on one of these trainings that their mother was taking ginkgo for memory. And she went to the doctor for a heart condition. She was diagnosed with heart disease and prescribed medication, but she didn't tell the doctor about her memory supplement that she was taking. And it turned out that those two didn't interact well and caused her a trip to the emergency room. And so it's really important if we're doing things that aren't prescribed that we still provide that information to our provider. Also, be honest. Be honest about your diet, your exercise, whether you've been taking the medication, about environmental activities like alcohol and smoking. The doctors and providers are going to make decisions based on the information they have. So it's really important, even if we find it's something we're not proud about, to go ahead and tell the doctor so that we don't leave something out that may in turn cause us more problems later. Remember what they told you and what to do after. This is hard for everybody, whether we have high health literacy or low health literacy. Sometimes when you hear you have diabetes or it's broken or you're pregnant or you need to lower your cholesterol, that's all you hear. And so it's a good idea to take somebody with you who can hear all of those things with a more clear mind, maybe. It's okay to take notes. It's okay to take in your questions. And a little tip is if you take in your questions and a pen, you can write the answers right there with your questions. It's okay to record the visit as well. Some people are never going to do well in a provider's office. We had a participant tell us that their mother would not ask a doctor a question. It just wasn't appropriate. If she wasn't going to be rude, not going to happen. And her mother also never remembered what the doctor had to say. Reminds me of my mother. And so, what this family did is because they weren't able to attend with their mother, they sent in a recorder and asked the mom to record the session or the appointment. And she did. And that was really a win-win for everyone. That way, the adult children knew what the doctor was saying. And if their mother had left anything out that was important, the adult children could help their mother go back and fill in some of the blanks. Know what to do before you leave. Again, ask questions, ask for handouts, video websites. Those are all things that are helpful. And also know not only whom to call if you have questions, but it is okay. Call back to the provider. They'll want you to call back. Some things like if you didn't understand something after you got home, how to take your blood pressure or how to do a self injection, call them back. If you're feeling worse or there's new problems, that warrants a call back. And if you were told that you were going to get test results and those test results, you don't hear about them, it's okay to call back. So that's real important. Some of us, maybe the way we were raised, didn't think it appropriate to ask providers questions, but it is okay to call back. And we've learned that providers want us to. All right, we're going to talk about medicine a little bit, and I'm wondering if does anybody have an idea what all of this might have in common? All right, I heard somebody say acetaminophen. Acetaminophen is a medication. Some people refer to it by the brand name Tylenol, but acetaminophen comes in all kinds of different medication, and that is important to know so that if you've taken a Tylenol for your headache and then you're going to take NyQuil for your cold and flu symptoms, you could very easily take too much acetaminophen, which can cause big problems for your liver. And so when it comes to medication, whether it's from the pharmacy or over the counter, you want to read labels. Make sure you know what the ingredients are. And if you have questions about those ingredients, remember that the pharmacist that you use is a very important person on your healthcare team. Ask the pharmacist to help explain, can I take these two things together? And even though they provide us a lot of written information, sometimes that just verbal conversation with the pharmacist is easier to understand and to process. So, 5 things you can do. We'll review those 5 things. Write down your questions, take notes, take a recorder, take an extra person, really talk with your healthcare team, all of them. Make a list of your medicines and share what you've learned with others about health literacy. Also, I think it's really important that we be patient with ourselves. Building your health literacy is a skill, and it's a skill that takes practice and time. And so don't be hard on yourself if you feel like, despite your efforts, you're still struggling with health literacy because that's common for so many of us. All right. So we hope that you've learned a little bit about health literacy, that we've given you some skills and some tools to talk to your healthcare provider, and that we hope we've expressed and you understand you're not alone, that many of us, all of us get confused at times, and that you can be a number one team player when it comes to your health and healthcare. Next slide, please. And this is just the closing slide for the presentation that talks about the Health Literacy Kentucky and the University of Kentucky College of Ag, who were originators of this health literacy for the WIN project. So thank you all. I think we're going to talk next about the Spanish language pilot.
Liz, are these your slides? Looks like she's having trouble coming off camera. There she is.
Sorry, I thought it was Emily, but that's fine. I like I said, we are very excited that we got to pilot the Spanish language version of this. We had talked about translating it for a really long time. So we finally translated it this year and then had some community health workers from La Casita Center and Michelle Hernandez from Health First Bluegrass work with us to kind of finalize the note section. And then we got to present it at the Southeast Community Health Worker Network and Summit, which was part of the Kentucky Community Health Workers Association conference, the kayak conference this year. So I'm just going to brag for a minute. It was the first bilingual presentation they've ever had in the 10 years of that kayak conference. And so that was really exciting. And what we did is our partners, the community health workers and bilingual folks from La Casita, presented it just like Kelly gave you a small sampling. We presented it in Spanish and we had Spanish speakers in the audience and they gave us feedback on what we could do to improve it. We did change a few of the slides. For example, Kelly did a few things about be honest with your healthcare team, and we added some other things that we know might be barriers for Spanish speakers, like be honest if you don't have insurance. Not to say that not that some Spanish speakers don't have insurance, but we know that there are plenty who don't. And so we added some talking points around being honest about fears about cost and concern. And those are things we can talk about with English speaking audiences too. But we tailored it a little bit in that way. We may still tweak it. We made it a workshop, so we got some feedback from the CHWs in the audience. But we did go on and post it on the Health Literacy Kentucky page. So when Emily talks about where those resources are, she'll be able to talk about where the Spanish version is as well. And we did include some resources that were already translated that we thought would be good and helpful. The Ask Me 3 questions that Kelly had shared, they already had that whole campaign translated into Spanish, for example. So we added that to the tools and resources folder. So I think now Emily's going to talk more about hosting a presentation and the resources and tips.
Yes, and sorry about that, Liz. I am looking for how I can get my video on. There we go. Hi, everyone. As Liz and Kelly were presenting, and I was looking at the participant list here too, I noticed that so many of you are in community-based roles, whether you're a community health worker, working for a community provider of some sort in a clinical setting, or working just in a community-based organization, a nonprofit serving your community. And so I hope that as we have been going through just a little preview of these slides that you can kind of visualize yourself doing this with the people that you serve. I can tell you, you got this very abbreviated version and it was kind of a one-way presentation, but you can probably imagine with some of the people that you work with that these slides elicit a lot of conversation, a lot of questions, and a lot of interaction. And it can actually be pretty fun. And sometimes, like with the Spanish version that we did at the kayak conference in September, it can be very easy to even go over 60 minutes when you've got a talkative group. But what I wanted to share with you today is the resources that we've created that have now been sort of described to you and where you can find them so that you can use these for yourself. So we have some objectives that I think have already really been reviewed as earlier in this presentation. And these objectives are particularly helpful if you were to be doing this with your peers and you also wanted to offer CEUs. You're always going to need objectives, and you're always going to need a little bit more of that structure if you're applying for CEUs. But it's also helpful when you're doing this with your community to just be really clear on what people are going to get out of the presentation. And then the lesson materials. We have a whole toolkit that we'll share with you that includes this PowerPoint presentation, both English and Spanish. We have pre and post evaluations that you can use. And that'll help you get some important feedback and see, how did this make a difference in someone's health literacy and their understanding of what health literacy means and what actions they can take. There is a flyer that you can use so that you can promote this in your community, a logo, social media graphic, really, everything that you need if you were to promote a presentation. And then some activities that you can do with the group as you're, going through the presentation. Word scramble, role-playing scenarios, question list. And so now I'm going to just show you where you can find this. Liz mentioned that it's on Kentucky Voices for Health's webpage. So we have a webpage within our website, I should say, that's dedicated to Health Literacy Kentucky. And I can also drop links in the chat after I'm done sharing these slides. But you'll find the health literacy page, tools and resources. It's an accordion style. So you click on it and then you can see that step 2, community members, Spanish, healthcare professionals, and teens. If you click into community members, you'll be able to see the entire folder for Lead Your Health Literacy for the Win. And then you can also see the individual files. You can download this so that you can keep it on your own computer, or you can access any of these files through this Google folder. And then there is a separate Spanish version. So there's a hyperlink there. So when you get these slides from Allie, you'll be able to click on all these links and access all of this for yourself. We also have a resources section, and that includes a lot of other great materials. And again, here's the hyperlink. And a facilitator guide. This is going to be really important for you to feel comfortable and confident in doing this presentation in your community. You're going to want to, really review the entire guide, work through it a few times, but it will help you to not only, provide the presentation, but to build in any of those other lesson materials that you want to use. And I should also note that the slides themselves have notes for every slide. So as you're going through the slides and you're, learning how to describe and kind of walk through these slides with your community, you'll have those notes and those prompts for questions. And then here we have those role-playing scenarios and the word scramble that I mentioned earlier, just so that you can get a sense of what that looks like. And I would say, especially with the role-playing, do that with a colleague, do that with a friend or someone in your family a few times before you do it with your community. But that can be a really good way of engaging people and, having, more of that active participation. And for people who are nervous about, asking questions, practice is the only way that, they're really going to be able to get over that hump. So the more you can practice with folks, and give them that opportunity for role play, the more they're going to be able to do it when they get in that office and, they're kind of deer in the headlights, don't know what to do next. I think we all have those moments with doctors, especially if we're not feeling well. And then this is the question list that you can go over with the group. And it's something that, if you make handouts, if you actually make copies and you hand it out to folks, they could easily take that to the doctor when they go next. We also really like to encourage promoting reliable resources. It's very easy, too easy, to go online today and find all sorts of stuff that might not be, fact-based, that may not be the kind of information that we want people to follow. And so Medline Plus and some of the other resources that we have in the toolkit are going to be the ones that you want to share with your community as the places to go when they have questions, when they want to look up a condition or a particular medication for more information. And then at this point, I think I'd just like to open it up for questions for people to share with us how you think you could use this presentation, this toolkit in your community. And Liz and Kelly have both done this in their communities with their patients a number of times and may also have some other tips to share.
So if anyone has
Is it possible
questions,
for people, I'm sorry, I was just going to say,
nope,
is it possible for people to unmute or to raise their hands, or should we look at the chat?
you can put questions in the chat. I believe I can unmute people if they raise their hand. Yes. If you raise your hand, I can click allow to talk, and that will do that. Um, one question I have for you all while we wait for some audience questions is, let's say there's someone in that kind of community organizer role. So maybe they're with a food pantry or a library or a youth group, and they think that this material would be really good for the people that they serve, but they're a little worried about they don't have specific healthcare experience. And so they're worried about, like, well, what if there are questions asked that I don't know how to answer? What would you say to someone to encourage them that they can do it?
I think that the way the materials are created is that you don't have to be a health professional to present this. It's really about empowerment of kind of ask questions, know where to look. So I think it would be important to clarify I'm not a health professional. I'm not going to be able to answer personal medical information, but I want to give skills that you can use. And it's kind of that angle. And then always, a safe answer is if you have a specific question, please follow up with your primary care doctor. I know for this Spanish resource, and I think we're going to put it in the English folder too, but Kentucky Voices for Health has done some one pagers about changes to Medicaid and who can get care or who can have Medicaid. And on the back, it also talks about low cost places to get health care. Or if you're uninsured, where to get health care. So I think that those, having that kind of handout to be able to answer that question will be helpful. But I think people should feel rest assured that you don't have to be a health professional to do this. Does anyone want to add any other response to that?
And someone did put in the Q&A that there seems to be trouble with the chat box. So you can type questions in the Q&A. I did see someone raise their hand. Oh, but it
And we
went
also have
away.
two other questions that have come in through Q&A. But if someone wants to unmute and ask a question, that's great too.
If you wanted to unmute to ask a question, raise your hand again and leave it until I can get to you. But one question that came in through the Q&A is, do you need to coordinate with your extension office, or is it okay to use this presentation on your own?
I think it's absolutely fine to use the presentation on your own. Now, coordinating with Extension is great just so that they know you are using it. It might be, helpful for them to know, but it's absolutely not a requirement. And I should also just say, for anyone who does use this, we'd love to hear from you and hear your feedback on how it's working in the community, what questions you're hearing. But again, all of that is really optional. It just gives us good feedback for any updates that we may make in the future.
Another question that's come in is talking about kind of AI and our phones, and there any thought about how that can help, hurt, whatever, how it's taking the place of professionals as trusted sources for health information? What are your all's thoughts about that in regards to should you even mention it while giving this presentation?
Funny because I actually heard a story, I think it was on NPR or public radio, like earlier just this week, that talked about AI in healthcare and how like it if you use I don't even know the functions, chat GBT or something like that, to ask medical questions, that it's leaning towards what the person kind of their own biases. So if they're like, I don't want to take any medicines, then it will kind of like skew towards you should never take medicines. And it like reassures you in that way because it's trying it, it's imperfect and it's trying to validate people. So I thought that was really interesting because we do lots of other health literacy presentations sort of for healthcare professionals. And my colleague Kristen Monroe Layton and I go to Spalding to their master's level OT program every semester and do a health literacy thing. And we spend a lot of time there about um, encouraging people to use reliable health information. So I was literally thinking like, oh, we're going to have to add AI into this discussion because usually we do this whole don't Google health information. Like Google is great for lots of different things, but you don't want to just, that's why we suggest Medline Plus because it has a search bar in the same way that you would on a browser, but it's only going to pull up vetted materials. So I do think it's something we need to be aware of. I'm sure that there are some helpful roles. I think it really depends. We're putting this presentation out there. You can download the slides, you know your audience, you can tweak it towards the digital literacy slant or towards, whatever population. And that's really where it can be helpful. You know the audience and kind of what they may want to ask or learn more about. Um, but I think, finding reliable health information could be its own session or a discussion point. So you just want to think about timing and the interest of your audience.
Someone does have their hand raised, so I'm going to click allow to talk, but full disclosure, I have not used this feature before on webinar, so I'm not sure that it's going to work, but we're going to try it. All right, Florence, did you have a question?
Yes, ma'am. Uh, has there been any plans possibly to create a video and to try to get into the schools? Because some of my experience is a lot of times it's the kids that help enable their parents to start asking questions. I go back to recycling and that whole initiative. I work for an FQ, and it would be really also beneficial to have something that we could play in the lobby to help people, feel more empowered that they can start to make a list of their questions or think about things that they really want to talk to their provider about when they do get back in the exam room. Thank you. This has been fabulous.
Liz, I'm curious if you have thoughts here. I know that we have recordings of this. I don't think that that would probably be the best thing to use with kids, but there are some really good like campaigns that from the past. I don't remember any. I'm not aware of any that are happening more currently, but marketing campaigns around health literacy, Ask Me Three, some national campaigns that have been used with commercials to just get people to be a little bit more aware of the importance of asking questions and being comfortable, with having that kind of dialogue with your provider. So, Liz, are there specific ones off the top of your head that you could recommend?
Yeah, I'm gonna make a note because honestly, I haven't played in our files, our Google Drives, but I know we've shared some videos in the past, and there are AHRQ, that national resource. They've done videos. Is that right? Yeah, AHRQ. Sorry, ARHQ. I'll look it up and put it in the chat. But they do a lot of quality and safety stuff. So they do a whole patient education. They have good brochures you can order about questions to ask your provider. They also had these catchy videos that I used in another presentation that are like you ask questions, like PSAs, like you ask questions at the restaurant, you ask the waiter a million questions about how that's prepared and what side dishes you can get. And then it pans to a doctor's office where the patient doesn't say anything. And so it's encouraging, you should ask questions. If you ask questions there, you should ask questions here. The other thought I had was about those Ask Me Three questions at Family Health Centers many years ago. We printed them, like had them printed on business card size. It's not that expensive to print business cards. So we did that size, but also because it's the same size as your insurance card. So we were telling people to keep it in their wallets with their health insurance card or with their other documents so that when they went to the doctor's office, they could pull it out. And if you don't know what to ask, you at least have that Ask Me Three. But they also have tear off sheets and papers you can print where there's room to answer the questions. So, Florence, for your point about like, it would be good to have something in the waiting room, we've done that before. And October is Health Literacy Month. So sometimes it's fun to do a campaign around that. It's been a number of years, but it was something that we did for a while at Family Health Centers. Kelly, I wanted you to answer a little bit about the high school or the student piece because ACAN has such a cool project around that.
So, yeah, I can talk about our project. We're doing CHW training in a high school, Central High School in Louisville, where at the end of this semester, these students will have a high school credit, a college credit, and they'll be certified community health workers. And really, it's been a beautiful experience for these young people and for me to see, because not only are they learning this information to use professionally, but they're gaining health literacy tools and skills as young people before, they're managing their own health. And so that they've received this training and know how to use it with other people and just starting with uh, the people who will be young adults. I really enjoy this. Also within our CHW foundational training, which is 40 hours around the 8 nationally recognized core competencies. We do thread health literacy through all of our modules. And then we make sure that we offer this as we do it a lot of times during our training when time permits, but when time doesn't permit, it's a resource that we distribute during that Build Your Binder session where this is a tool community health workers can use. I
Thank you.
wanted to add about the Ask Me Three also. I visited a FQHC here in Lexington and they had a big, huge signage with the Ask Me Three. It might have even been in their PV or their, the looping signage, but I thought that was great. And Ask Me Three might offer free materials. They have their own website.
Thank you. Another question we have is, at least in the snippet example of the presentation we did, it didn't talk about cost or insurance that much. Is that part of the overall resource kit of the presentation? Are there other resources about health insurance literacy that we can share?
I do think that there's some information in the longer presentation about your health insurance card or just, how you can talk to your providers about, how about your coverage. But we created a health insurance literacy training module, a series of modules a few years ago. And I say a few, I think it might have been before the pandemic. Uh,
Time
now that I'm
flies.
thinking about the timeline. So it may be that some things are a little out of date at this point, but the basics about, your coverage, about those terms that we often hear with premiums and deductibles and copays and coinsurance, that would still be relevant and accurate. And that is also on the Health Literacy Kentucky page, all of those modules. And I can make sure to share those links with you too, Allie, just so you have a few of the easy links to put in the follow-up email.
Awesome. Thank
And
you.
Liz, do you want to say anything else about that? I know you were part of the creation of that series as well.
Yeah, I think the health insurance piece is pretty complicated, so it might merit its own discussion. And as Emily said, we had some resources on Health Literacy Kentucky on the insurance presentations that you all are also welcome to draw from. In the Spanish materials folder, we don't, I want to point out, we haven't translated role plays yet, or all of the materials, but we wanted to go on and get up what we have instead of waiting for everything to be perfect. So what is there are the slides in Spanish and the notes all in Spanish. So if you're a Spanish speaker, you could go on and use that presentation and feel pretty good about reading it or getting familiar with the content that's there. And then a few translated brochures and resources you may want to print off as handouts. And one of them there, it's not about insurance necessarily, but it's about levels of care, it's a handout that I handed out to every newly arrived refugee in Louisville for decades when I would do a health orientation class, because it's kind of really important to know, in the United States, you can't go to the pharmacy and get a prescription if you haven't seen a medical provider, right? And in lots of places in the world, you can go ask the pharmacist for prescriptions. But that level of like, when you have this kind of sickness, you can go to your primary care or an urgent care center. When you have a much more serious sickness, that's when you go to the emergency room. And it kind of is an ER brochure, but it's kind of when to use it, when not to use it. So I think those kinds of resources can be really helpful for people um, with any background, but in particular, since that one was available in Spanish, we included that one.
Thank you. Another question we have is, how has this program improved health literacy over the time that you've been working with it? What kind of feedback have you all gotten after giving presentations?
I will say we haven't been quantifying it, and we haven't done this newer version. The ag extension folks might have, they were doing evaluations and reviewing them or they were asking their extension workers to do that. And Heather wasn't able to join us today, so I'm not sure how they've tallied those results. When we did the health insurance literacy part a number of years ago, we had a researcher, a nurse who is a researcher who is helping to do before and after quizzes. But on this kind of community-based thing, we haven't done any formal evaluation that I'm aware of. So you might want to think about that if you're working at an agency that wants those kind of measures, kind of thinking about pre and post evaluation, perhaps.
Yeah, I think you could easily incorporate that in because we have the pre and post already available, and it would just be a matter of tracking it and, doing that kind of assessment over time.
And I'll also share, when we did the pilot of the Spanish version at the kayak conference, one of our colleagues from La Casita Center made a Menti, like where you can do an interactive couple questions at the beginning of the presentation. And the questions were from the presentation. So it was kind of like a pre-test, but it was interactive and fun. So if you're tech savvy and you want to do something like that to make sure you get participant engagement, and then you could also follow up. I mean, that could be an informal way of kind of pre and post. So it was fun. She had prizes. Those are always fun.
Thank you. Kelly, were you going to add anything? I saw you come off mute for a second.
To add just that we get feedback from CHW Foundational Training, and I have had people specifically mention this as a tool that they really appreciate my questions when I ask what's been most valuable, what needs to be improved. I have had people talk about having the words to say to engage people this way. Yeah. And just even how to ask those questions and so the CHWs that I see, and I do see a lot, have been finding it useful.
Thank you. One question we have, are there any resources as part of this, toolkit that are more directed to the healthcare workers?
So this toolkit itself is what you have seen today. And so if healthcare workers want to use it with patients, with their communities, they're welcome to. I did want to go back and show you one of these screen shares or screen grab that shows the accordion. So here, when you go to our Health Literacy Kentucky page, you see the 4 community members. That's what we clicked into. And then, of course, for Spanish speakers, that would be the one for this same presentation in Spanish. For healthcare professionals is that third line. So that's where I would go to find resources for healthcare professionals. It's not the same, but it's very similar components of this, including, that Ask Me 3 and some other things that that healthcare providers can use in their practices.
Emily, I'm just going to add, I didn't want to mention it earlier because I couldn't remember if it was still there, but the bottom one is for teens interested in healthcare professions. And so, really, what that is sort of a version of the what is health literacy? What can we do about it? Um, Version that we do for the Spalding OT students, but a few years ago we were asked to do it for a summer program that AHEC was running in Louisville, Kentucky for teens who want to be in healthcare. So we tried to make it a little more interactive and geared toward a teen audience. So no promises about how outdated like graphics or things are because we did that a long time ago. But again, it's there and you guys are glad, welcome. We would be happy if you use any of these resources or download them and use them as a basis for whatever new materials you want to work on.
Yeah, that's a really good point. You are welcome to adapt these. And if you wanted to take the presentation that we did today and add in a slide about AI, that would be something that could be useful for, how you want to present this in your community. I'll also note that underneath that first accordion, which says Health Literacy Kentucky Materials, the next line is Kentucky Health Insurance Literacy Training Modules. So I mentioned that earlier, and that's where you would find them.
Thank you. All right, we're going to do one more question. And I'm going to preface this before I ask it. I know that none of us are AI experts ourselves, but someone asked, what do you think about, putting into ChatGPT before you go to the doctor, saying, I'm going to the doctor for X condition. What are some questions I should ask, or what should I point out during my appointment? What are your all's thoughts about doing something like that?
I have no personal knowledge or
Right.
experience, so I don't know
Like
what it
I
would say,
said,
but I suspect it wouldn't be a bad idea if somebody's using that and they're kind of stuck on what questions to ask. I will also point out, I did put in the chat the AHRQ. I didn't want to get the letters wrong, but I double checked it. They actually have a question builder tool um, that I've personally used for a family member who was getting healthcare up in New York and didn't know what questions to ask. So I was able to go and pick out what I thought as a nurse and as a sister-in-law would be helpful questions and send it to him. But I used the AHRQ question builder tool. And it what it does is there's like a million, but it takes into consideration kind of the length of one visit with a provider and sort of makes you narrow down to 3 or 4 because that's the reality of what you would get to do in one encounter. So anyway, I think AI would quite likely, I'm guessing, pull from something like that. I would hope so. Like there are plenty of available resources about what questions to ask. And then Emily showed us that version that extension helped make so that there was a handout that was easy to grab. But yeah, I suspect that could be helpful just to lend people towards, ultimately it's going to list a set of things and the patient's going to decide which ones are important to them. And sometimes with 1 or 2 questions with a provider, the provider's going to steer it back to what they think you should know,
Yeah.
or give you more time for other questions.
Yeah, I was just going to say the key to me there is that they're asking the provider to verify that information or, to educate them further. So as long as that component is there, where they're going to a medical expert, I think that'd probably be a good tool to use.
Yeah, I
well,
just want to add like
go
sort of a
ahead. No, go
closing
ahead.
comment. Sorry, it just goes back, what Emily just said is perfect because it goes back to the whole theme of this and that very first slide that Kelly did, which is like who's on your healthcare team. And so, as long as you're remembering, hey, the pharmacist is a great person. I think we forget about pharmacists all the time that they can help us pick the safe over the counter medicine that doesn't interfere with our blood pressure medicine. Or the nurse can be who you call to ask a question when you forget when you get home. So, I just thought that was a lovely way to kind of tie it all up, that it goes back to your healthcare team and that you're the key to that team. Sorry, I'm
Absolutely.
cheesy, but that was like a perfect wrapper.
Oh, 100% agree. We're 1 minute away from noon Eastern time. I wanted to say thank you again, Emily, Liz, Kelly. That was fantastic. Really, really helpful information. And thank you to everyone who joined for engaging with us and being such a great audience. So with that, they've got their emails up. Be on the lookout for that follow-up email that I'm going to send on Monday that'll have all these links and the recording from today. And with that, thank you again. Happy Friday. I hope everyone has a great weekend.
Thanks. Have a good weekend.